everyone, I am Dr. Rajkatharat and today I shall be discussing mouth matters during pregnancy. Pregnancy is a unique time in a woman's life which is characterized by complex physiological changes, some of which may adversely affect the oral health. When preparing for the arrival of a new baby, it's easy to get overwhelmed, so much so that your own oral health takes a backseat. At times like these, it's important to remember that it's only when you start to take care of your own teeth, you are also starting to care for your babies. So let's get down to the nitty-gritty of it. How and why does the mouth matter so during pregnancy? The mouth is an important portal of entry to the human body, and oral health not only reflects but also influences the general health and well-being of an individual. Maternal oral health has significant implications on infant oral health as well as birth outcomes. So let's see how maternal oral health is linked to an infant's exposure to dental caries. Dental caries or tooth decay is one of the most common chronic childhood oral diseases that affects about 30 to 60% of children as well as a vast majority of adults worldwide. It impacts on the quality of life and can be one of the reasons that thousands of children are needing dental treatment under general anesthesia in hospital settings, along with the associated high costs as well as possible health risks. Evidence shows that these young children and infants acquire these caries-causing bacteria from their own mothers. A mum who has a large number of acid-loving bacteria in her mouth can pass on these damaging as well as aggressive bacteria to her newborn, which might cause trouble down the road. Just imagine a 2 or 3-year-old having to undergo dental treatment for multiple cavities or even an intensive treatment like root canal treatment. It doesn't have to happen this way. Our children are not destined to have cavities. Good oral hygiene habits as well as healthy eating practices established early on in life can significantly reduce the risk of dental decay. Now let's see the link between maternal oral health and birth outcomes. A pregnant woman who has a large number of bacteria in her mouth can cause these bacteria to enter the bloodstream through the gums and then travel on to the uterus, where they can trigger the production of chemicals called as prostaglandins. These chemicals are suspected to induce premature labor. The hormonal surge that happens during pregnancy can lead to a painful gum disease called as gingivitis, which is characterized by red, tender, swollen as well as bleeding gums. This condition is as unpleasant as it sounds, and if not attended to, it can progress on to a more severe condition called as periodontitis, which involves bone loss. Research has found a link between periodontitis and preterm as well as low birth weight babies. Periodontal disease during pregnancy can also predispose a woman to preeclampsia, which is a hypertensive disorder of pregnancy and is known to significantly increase the maternal as well as fetal mortality and morbidity rates. So, a woman's preconception as well as pregnancy experience with the two most prevalent dental diseases, that is dental decay and periodontal disease, not only affects her own oral health but also increases her risk to acquiring diseases like rheumatoid arthritis, diabetes as well as atherosclerosis, apart from affecting the birth outcomes as well as predisposing her newborn to early and severe dental caries. The question that we need to ask ourselves is, how do we utilize this time wisely? How do we treat this time not as a waiting room, but consider it as an opportunity to up our oral health game and set even higher hygiene standards? Stay tuned for the do's and don'ts in my next episode, Healthy Smiles for Two. In the meantime, keep smiling and namaste.